Botox is one of my favorite treatments to perform, and the reason I like it is that it's really accessible to almost anyone who has frown lines, crow's feet, or forehead lines. In other words, motion-caused lines in the upper face. We treat patients as young as their 30s and as old as their 60s or 70s. What Botox does is interfere with the muscle-nerve communication so that when you think, I'm going to frown, the muscles don't react to it. What that does is improve the lines that appear between the eyebrows, and those lines make people look angry, mad, tense, tired. They usually don't convey a positive image. So when you can relax those lines, people have a more refreshed and happy look. Crow's feet, I think especially for women, but also for men, can really be a telltale sign of aging. I remember younger, looking at people, I'd look at their hair color and their crow's feet to see what age they were. And so you can soften crow's feet tremendously, and by that I mean these lines coming out from the corners of your eyes by relaxing the muscle that is on the outer corner of the eye. And then forehead lines, when you lift your eyebrows, and a lot of people do that a lot, and really create some deep furrows. We call these wrinkles memory lines because the skin has been creased and now there is the residual crease there. So when you stop the muscle activity, you relax the muscle. It does not leave you numb or paralyzed, and dosed appropriately, you still have very normal facial movement, but the creasing is diminished greatly. A very common question people ask is, oh, I'm afraid of Botox because it's a poison. And I'm old enough to remember when people did die of botulism poisoning from improperly stored food. We're using a medical grade purified protein from the botulism organism, and it's been used medically in large doses into large muscle groups for 30-35 years to treat strange muscle contractions, or with someone, for example, with cerebral palsy, into the large muscles to allow that limb to relax. So we know that we can very safely use the tiny amount of units that we're placing into these specific muscles. The Botox doesn't go to other parts of your body. It's not having an effect distant from where we place it. So there are three main manufacturers or providers of botulism products at this point: Botox, there's Dysport, and there's Xeomin. And we do offer all three products. We only provide treatment with a product from the U.S. manufacturers. That's very important. The rare side effects that you've heard about that make national news were off-label Botox products, and we would never go anywhere near those because of safety issues. Frequently, people want to know, how long will my Botox treatment last? And that will vary from person to person. The FDA says 3 to 4 months, and we do see some patients where the effects will last up to 6 months. It really does depend on the person, their facial expressions, the strength and the size of the muscle, and often with longer duration. For example, you can retrain someone. When they're not frowning, they lose the habit of frowning, in which case that can have a much longer duration of the desired result. When a patient comes in, they often ask about Botox and filler in the same sentence, and that's because these products are often discussed together and the patient may not understand what is used for what. So Botox is used crow's feet, frown, forehead lines, so generally from the eyes up. There are some exceptions where we'll use it in the lower face, but it's not the norm. Fillers, on the other hand, replace volume from the cheeks and lower eyes down. So they're very different products. I've had a patient yesterday come in and say, I need Botox right here for these lines. And I explained to her that we really don't want to stop movement creating these lines, or you're not smiling and moving your face normally, but that we want to lift these lines with filler. And also people will ask, well, how much downtime is there? And generally there's no downtime with Botox. While it's always possible to cause a small bruise anytime we place a needle into the skin, it is not the norm to have bruising. It can happen as a rare exception. And it will usually take 7 to 10 days for the Botox to kick in. It's a gradual onset, and so new patients will come back at 2 weeks so we can make sure we've achieved the desired result.